What does a PVR test tell you about bladder function? Have you ever wondered how well your bladder is doing its job? A post-void residual test, or PVR test, can give you some important insights. This test measures how much urine is left in your bladder after you have urinated. Understanding this measurement can help identify how effectively your bladder is emptying. In a healthy bladder, only a small amount of urine, typically between 30 to 150 milliliters, should remain after urination. If the PVR test shows a larger volume, it may indicate that your bladder is not emptying completely. This condition is known as urinary retention and can be caused by various issues affecting bladder health. The PVR test is particularly useful for diagnosing and managing several conditions. For instance, it can help identify neurogenic bladder, where nerve problems disrupt bladder control. It can also reveal urinary outlet obstruction, which may occur due to an enlarged prostate or strictures that block urine flow. Other causes of urinary retention can include mechanical obstructions in the urinary tract, medication side effects, or postoperative complications after surgery. Additionally, urinary tract infections can be linked to incomplete bladder emptying. The PVR test can be performed in two main ways. One method is through non-invasive bladder ultrasound scanning, which uses sound waves to estimate the volume of urine left in the bladder. The other method involves catheterization, where a thin tube is inserted into the bladder to drain and measure the residual urine directly. Both methods provide a clear picture of how well the bladder is functioning. In the context of bladder health and bladder cancer, the PVR test can be particularly valuable. Bladder cancer or its treatment may affect how well the bladder can hold and empty urine. By measuring the PVR, healthcare professionals can make informed decisions about treatment options and symptom management. Overall, the PVR test serves as a vital diagnostic tool. It complements symptom assessments and other urodynamic studies, helping clinicians understand bladder activity and detect urinary retention. However, it is essential to remember that interpreting PVR results should always be done by healthcare professionals. They will consider the full clinical context, and if any abnormalities are found, further evaluation and management may be necessary. Always consult with your healthcare provider for personalized advice regarding bladder health.